Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day. Coming up on today's update, 3 years of COVID-19. The pandemic forced hospitals to adapt quickly. We reflect on the challenges and the celebrations, including this love story made possible by a COVID connection. You'll meet two frontline workers and the forever bond they now share with their patients. 3 years ago today, back in 2020, doctors admitted the very first COVID-19 patient here at the University of Kansas Health System. They were the first of what would be thousands. Soon, there were lockdowns, face masks, and a global push to stop the spread. Today, we are reflecting on the pandemic with those two doctors who helped really guide us through the anxiety and the uncertainty during that time. Chief Medical Officer Dr. Steve Stites and Medical Director of Infection Prevention and Control Dr. Dana Hawkinson. They were familiar faces. People tuned in every day just to see how things were changing really hour to hour. So we're going to talk about where we are now, where we may be heading, and of course we're going to take a look back. So, but we're also taking your pandemic questions. If you've got them for the docs, send them in to YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. But before we dive in, let's start with one of those silver linings, as we called them. We heard and we remember the traumatic stories from the ICU, but between the intubations and underneath the PPE and those masks, a love story was brewing between two frontline workers.
So you're not working from home anymore?
Meet Tony, Bethan, Richard, and Candace. 3 years ago, they were complete strangers. But leave it to COVID to change all that. It was during the darkest days of the pandemic that ICU nurse Bethan noticed the new guy on Unit 61, respiratory therapist Richard Yulin.
And I remember just watching him walk past me, I was like, he's kind of cute.
But that was about it.
She kept telling me she wasn't ready to date. So I had to kind of just keep asking.
What started as two colleagues leaning on one another for support eventually turned to more.
A lot of times what we would do to kind of cope with how difficult COVID was is we would go out after work and we'd get dinner together as a group, and we ended up going just to dinner one night.
The rest was history, as they say, except there was another man in Bethan's life who was desperately fighting for his own, Tony Gutierrez.
I remember them telling me, it's time to put you on a ventilator, and I wasn't ready for that. I was like, no, and they did a FaceTime call with my families, and I said, all right, well, I'll fight this. Said, told them I loved them, and honestly, I thought that was my goodbye. Didn't want to say goodbye, but that was my goodbye.
COVID hit Tony hard. His devoted wife, Candace, documented his nearly 3-month hospital stay, including the care Richard, Bethan, and the medical team provided.
Some of us were so sad because he had young kids, and that was what really kind of hit us in the heart. And then when we got to talk to Candace, and when Candace came up, then we were like, Tony's gotta make it. We're gonna do whatever we have to make Tony make it.
Tony hung on, and before long, this pastor, husband, and father of 3 came off the ventilator and began trying to get strong enough to get out of room 6112, while also bonding with his special friend, Bethan.
I just remember her telling me about Richard, and she's like, he works here and he's out there, and so like him being at the desk and I'm like, oh, okay. I think I asked her if they were what was going on, and she's like, he's taking forever to ask me to marry him, and so I'm pushy. I'm a minister and just pushy guy, and so I was just like, where's he at? Bring him in here.
And with his not so subtle nudge to Richard, he set himself a goal and made a promise.
It's like, hey, I'll do the wedding when you guys get married. When I get out of here, I'll do the wedding.
First their patient, then their friend. Tony kept that promise, made it out of the hospital, and married them right here in their backyard.
Tony's basically family at this point.
A family that keeps growing.
He's so cute.
Meet 8-month-old Graham, Bethan and Richard's son. Another bright spot in this story and proof there is life after COVID.
I love them and what they've done for us. We can never say thank you, and I feel like being a part of their family and being able to tell Graham how his parents are rock stars, and it's just a joy.
And all those rock stars are joining us this morning. Bethan and Richard and Graham and Tony and Candace, so good to see you all. And just thank you so much for sharing that really uplifting story. How are you guys doing?
Good morning.
Good morning. Good morning. We're doing great. We're glad to be here and excited to be on this morning with you guys.
Well, great. It's nice to have you here as we reflect on 3 years to the day anniversary of our first patient. Bethan and Richard, what do you both most remember from those first days? I mean, really no one knew what was coming.
Gosh, I took care of my first COVID patient on Friday, March 13th. And I think that's a day that will kind of stick with me and kind of stick with all of us. But yeah, we just had no idea what was going to happen. And I just remember we were just kind of like sitting and waiting those first few days. And when that first patient came in, we were just kind of, I don't know, jumping into the unknown, I guess. Yeah, for sure. Richard, what do you remember?
Yeah, I think the biggest thing I remember is just everything was changing every day. I remember for, the respiratory side, we'd get an email from our manager every single morning with basically the new rules of the job, how you do your job. Mm-hmm. It's changed every single morning. So just different every day.
And Bethan, so interesting because this was your first year. You'd only been a nurse for 6 months in the ICU when COVID hit. You had told me once that there were days it was, you said this, body bag after body bag. And that is a lot for even the most seasoned healthcare worker to have to deal with. How did you manage that?
I think when it was, actively happening and when we were just like so intensely in COVID, you just kind of had to get through it. I mean, it's true. There were days where we were like having to take body bags from other units and it was horrible. But I think, when you're in the middle of this like high adrenaline, constant barrage of like very critical patients, you just kind of get through it. And I don't think it really hit what was happening until months, like almost a year later, when you kind of looked back and reflected on everything that you've been through. I think that's when everything hit. But I think in the time, it was just, you just had to get through your 12 hours and you had to do what you could for these patients. And you just kept on doing it because it was just what you had to.
And I remember you telling me back then, of course, visitors were allowed in so many cases and families were saying goodbye, their final goodbyes on iPads. You said that those moments have and continue to stay with you. Tell me about that.
Yeah, so a lot of times, like Tony kind of alluded to in the video package, we would, before we put someone on the ventilator, we would give them every chance to try and talk to their family one last time just in case. Because you never knew. Sometimes people did really well on the ventilator and sometimes they never came off. And so we would give them the opportunity to talk to their family. And it was, I would never want someone to be in that position ever again because it was horrible. It was, the most potent emotional feeling. Sometimes patients were on BiPAPs so their family couldn't understand them. So you were kind of translating what they were saying. There were couples who were married for 50 years who were saying their goodbyes. There were parents saying goodbye to their children. And I think that is the one thing that I think will kind of forever haunt me about this, and maybe forever stick with me, but something that I think that probably was the one thing that really kind of sent me into therapy and made me kind of talk through everything that had happened, because it's just such a brutal experience to a perfect stranger, spend that really intimate moment with them and not be able to have their family there.
And Candace, you were one of those. You were a spouse unable to be there in many cases in the beginning. And I know you were doing some communication over the iPad about when Tony was going to be going, being intubated. Such a scary time. But what was it like for you at home and watching this from afar?
It was every bit of horrible as Bethan said, not knowing him being so healthy and active, and then within 6 days him going to just steadily declining to being put on the ventilator. And I'm not from the medical world, so everything that was happening was just so far over my head that I couldn't understand what was going on and the rapid decline in his health. And even from that morning when I got his FaceTime and he was telling me that he had no other option and we were here and just waking our children up, still gets really emotional.
I know it does. And Tony, sadly, your story really wasn't unique, except that you were able to make it through with your faith and family and friends and these guys that we see here today. What do you remember most about your time in the hospital?
You know, I think I just remember the most, and I say it over and over again, you know, just care that I received, but the care that my family received. You know, from nurses, you know, Bethan, not only Bethan, but so many nurses that took care of my family during that time. I think when I was alert and awake and knowing what was going on, seeing just the care they had, the relationship they had, the checking on them, making sure that Candace ate, making sure she had stuff, and just, you know, like I said, not only caring to me, but caring to my whole family meant the most. And people coming in, checking that had cared for me at one moment that weren't caring for me at that time, but still were vested in what was going on. And so to me, I always say, you know, they didn't only save me, they saved my family. So I think that's the most important thing to me that I remember the most.
Well, and what's not unique is, you know, the care that Bethan and Richard gave. I mean, that was happening all over the health system here and across the country. But what do you think it was about Bethan in particular? Tony, what was that bond? What connected you so much with her?
Well, you know, Bethan, she's great. She's funny. And so I think it was that. I think, you know, the time that Bethan cared for me, probably you know, it was a good stretch of 6 days that I can remember, but I think I was probably the most alert at that time. And so I was alert, I was awake, we were joking, you know, it was just that care. And so I think it was the funny, she wasn't talking to me as a patient who was sick, but as just a person. And so, and it just, that's me. So it just seemed right that it was just fun. You know, it was fun to talk and fun to know what was going on, and it just seemed like she cared. And so I think that's probably the thing that stuck out the most to me. So.
Okay, guys, I want all five of you to hang tight if you can. Graham, hang in there if you can. I'm going to turn to Dr. Stites and Dr. Hawkinson for a moment. They're going to take us back a bit, and we'll get to some community questions here in just a moment. But before I ask you guys about your memories, I have to ask you to comment on this story. I mean, when you saw so many unfortunate endings, I mean, to hear and to see something good, it's got to hit you hard.
It does. So I get weepy at commercials, so I had to get weepy during the video, and you know, it's in a very dramatic and touching way. It is the message of what gets people through bad times, right? Mm-hmm. You know, all the care in the world is great, but, and we've said it before, faith, hope, science, in this case love, faith, hope, and science really wins.
Hawk, what are your thoughts? I mean, just seeing some good happy endings. That's something that we had really in those dark days hoped for.
Yeah, no, I think it is a microcosm. It's an individual story of everything that was going on across the nation, just as you mentioned, Jess. It's not a unique story, unfortunately. It happens so many times, and it's the families, but it's also those caregivers who are compartmentalizing so they can get through not just the day, but the next hour, the next 20 minutes to be able to do what they need to do to provide the best care for those patients.
I know we're going to run some numbers here in a bit and kind of look at COVID on a big 3-year scope. But before we do, I always like to go back and ask you both, what was that one moment? Was there a phone call, an incident, a conversation you had that really made you realize that things were really about to change?
Yeah, no, it was reading all the articles, but the thing that really just crystallized it was we were talking about Saturday or Sunday when I was here and did the first pulmonary consult on a patient with COVID, and it was in our infection control unit. You know, it was new to us. We'd seen the pictures from Italy. We'd seen what was going on in New York. And here's our first patient, I think the first patient in Kansas City with COVID-19 that was hospitalized.
Yeah.
And I remember, and the thing I remember most is the fear in her eyes.
Mm-hmm.
And a young woman, she'd been in Boston, there was a medical meeting, and that meeting seeded a lot of the United States. And I remember taking care of her and looking at her, and there's so much we talked about didn't build an airplane, or at that point we still had maybe one wheel, and we just didn't know anything, right? And she was fearful. We were dressed in our moon suits, looking like astronauts, and it was just, that was the moment where you were just like, okay, we're all scared right now. And I think she was scared, we were scared, and it was tough. And she was sick, and she was a young, otherwise healthy person.
And Hawk, people come here and they look at you guys and they think, I'm going to come here and I'm going to get good answers and I'm going to get more information than what I walked in here with. And there was a lot, like Dr. Seitz said, you just didn't know. You were learning right along with the public. What was it like, and what do you remember?
Yeah, well, first of all, I'd just like to talk about what Dr. Seitz was talking about. You know, I think he was talking about the moon suits and the unit, the special unit. We should say, those were processes and places that were built over years, and it first started with being prepared for Ebola when that was coming. We had that in place, luckily, so we were able to utilize that. Certainly shift some of those processes, but we had that in place, and we continue to work on that today for any other new emerging infections, unfortunately, because we know that there are some. The one moment that sticks out is really the same day as Dr. Seitz is talking about. It was early on that Sunday morning, and I was just getting off a plane because I was actually at an infectious disease conference. So we were getting back, and we had then after that, it was like 9:15 that I was getting off the plane, 9:15 in the morning, and we had like 6 or 7 hours of meetings on that Sunday just to start to really hammer down what our protocols, what our systems were going to be for this patient, but also moving forward. And I think it was really that Sunday as a whole, just how so many people in the health system dropped everything they were doing that Sunday, had 6 or 7 hours worth of meetings to really try and cement what we are going to be doing moving forward.
And then away we went.
Yeah.
Let's do some show and tell, run some numbers, let's see it.
I got a few graphs. First of all, it's the good news. So you remember this heat map? We talked about this heat map like 1,000 times, I think, and probably whatever 3 times, 3 years. But it looks good, right? There aren't those little dark dots. There's a few of them where there's some outbreaks, but this map looks a whole lot better than it did about a year ago this time. So let's go to the next picture. And yeah, there it is, that really great big spike. And I think that was January, February. We got up to 250 COVID patients in beds here. And that number is unbelievable to me when you think that we just don't, it just makes your head hurt. And that was a time where we were getting all the CMOs together and all the political leaders, and we said, guys, we are in trouble. We can't take care of all the sick folks right now in Kansas City. And there were people with strokes and heart attacks who couldn't get timely care. I mean, we were over the ledge. And I don't think we knew that we were over the ledge because we were all trying to hang on to the ledge. Yeah. And our staff was over the ledge. People were overwhelmed, and we couldn't get care. The ED was backed up, and the hospitals were all backed up, and people were just trying to get through the day and survive. And fortunately, things are so much better now. If we go to the next graph, because you saw it tail off, this is the impact of vaccination. And just to think about this for a minute, there have been 676 cases of COVID that we know of globally. There have been 6.8 million deaths, so a death rate of 1% of the cases what we knew. In the United States, 103 million cases and 1.1 million deaths, so it makes it one of the leading causes of deaths, and it came out of essentially nowhere. What saved us? You know what saved us a lot? 13 billion doses of vaccination given globally. And there's still, I don't know how, but there is still controversy out there, but 13 billion doses, and people still want to worry about whether it's safe. I'm telling you, that is the most used drug over the last 5 years in the world, 13 billion doses. And you watch the curves fall. If you go back, can we go back to that prior graph for just a moment? I remember sitting in this very studio and we said, finally, we're on the offensive. We're like Patrick Mahomes now. We can go against this virus through vaccination. And so as the virus transformed, more people got infected, but a lot of people were vaccinated. the pace of this whole pandemic began to wind down, and it hasn't gone away, because I think today we still have 50 patients hospitalized, but it has gone down. So if you look down at that, go back to the next slide again, it's instrumental for us, and it's instructive that we got people vaccinated, a lot of people had COVID, and between those things, we can see the death rate, which has dropped so dramatically overall, and that it's not as fully different now between fully vaccinated and vaccinated or unvaccinated, in part because so many people have had COVID. But when you were having it and you were older and you weren't vaccinated, those are the folks who were dying. And now we don't see the same amount of death as we did before, and the death rate continues to fall. So we're in a much better place in the pandemic than we were. And Hawk, it's interesting to me, it's really run a 3-year cycle, which if you go back to the influenza and other things, you kind of see that same cycle. We're better off we were. We took masks off in the hospital yesterday, so we're clearly in a better space.
Yeah, absolutely, absolutely.
And Doc Hawk, you've been giving the COVID count for the last 3 years. I know, we've lost count. You're like, you've been doing this every single day, and so many people have counted on those numbers. But today you've added up some different numbers for us. COVID numbers from March 2020 to now. Kind of help us understand what we're seeing. So
unique patients, we talked about the thousands of people and admissions that have come in. 5,600 unique patients. 6,300 admissions. So some of those unique patients had gotten admitted maybe 1 or 2 more times for symptom control and things of that nature. Average age is 57, but I would like to comment, that average age, if we took the last year, I would say that average age is probably increased. I think a lot of that average age is from when we had the bulk of our patients, and probably those were definitely a broader range of younger patients and older patients. What we're seeing now is certainly kind of tending toward going those older patients, but especially those patients with significant comorbid conditions as well. The next thing we have is our ICU patients and deaths. So we've had 1,400 ICU patients. Of those, we've had 835 that were ventilated, and deaths 1,100 as well. And what I would like to say is probably when you take COVID-19 and you compare it to all of the other respiratory viruses, including RSV, influenza, over 3 years, we would not see anywhere near those numbers, and that's the impact of COVID-19.
And it's not close, right? It's not even close. If we see deaths from influenza in 1 year in our hospital, it's nothing like that.
Correct.
And in the last, I mean, it's just not even close.
Okay, so I learned a lot during this time. A word that I had not heard of was proning. We have some video of the COVID ICU unit showing what it was like to prone a patient. And I want to bring back in our guests because Richard, Bethan, this is basically, it takes a small, large team to flip someone over on their belly. I mean, these were some of the last ditch efforts to help somebody breathe, right, Dr. Stites? I mean, this is helping your lungs.
So proning like this is not a new thing. We've been doing it for years. But what happened with COVID is it was very dependent. The impact of COVID was very dependent upon where the virus went. When you lay on your back, the virus is going to the back edge of the lung. And so it was really something we had to do to help get airflow to the good part of the lung.
And it is a really, talk to us a little bit. I've seen the images, but Bethan, Richard, kind of tell us exactly what's involved in doing this.
It's really, it's one of the biggest team efforts I remember. We would have these, days where there was 5-6 people on the unit where we had to flip them all, and we kind of go room to room. But then you have to have an RT there to manage the ventilator. You have to have one nurse managing all the lines for the patient, and another nurse that's managing the lines at the other side of the bed, and then more people just for the manpower. And some of them you would get them flipped over, and then you'd either have trouble finding their vitals, or you'd see them go down, or you'd have a lot of issues come from it too. So then add on top of that there's 6 other patients on the unit that need the same group of people to flip them. It was a lot for a long time.
Yeah. And I know, Richard and Bethan, you guys did this to Tony many, many times. Candace, when you got the phone call that they're going to be proning Tony, had you heard of that? What were you thinking? What were they telling you?
Yeah, no, I had no idea what that meant.
he normally sleeps on his stomach, so when I would FaceTime him and get to just talk with him, I would notice there were times when he was on his belly for a good amount of time, and then there would be times when he was on his back, and yeah, and they did it longer for him than what I think the regular protocol called for. I think they did it 3 times the amount for him.
Well, they're doing something right. Dr. Hawkinson, I know you spent a lot of time up on the ICU units checking on patients. We followed you one day just to kind of get an idea of what your life was like up there. But what kind of care were you providing some of these patients? You know,
unfortunately, early on, it wasn't much at all. I had one patient ask me, "What can you do for me?" This was very early on in one of those local facility outbreaks when a patient had come, and there was nothing I could do. You know, it continues to be helping with the supportive care, looking for other infections. But as time went on, we were able to have better therapies. We had remdesivir. Of course, the steroids were being implemented. So a lot of it was just talking with the patients, trying to explain what was going on with them as well, what was going on with the virus, what we knew. So a lot of it was not necessarily physical, but probably more emotional and mental, and just really talking through with that patient. Obviously, they weren't intubated at that point in time, but luckily, later on, like I said, we were able to develop and get some antiviral therapies to help a lot as well.
And this is how you were spending your days with patients, but you'd kick off your day every day down here in the studio. And Dr. Seitz, you know, we started this program really to update the media in those first few days, hour to hour. Media was calling our office down here so much, and we couldn't keep taking you guys away to do one-off interviews. So it was like, well, let's just get everybody on one call. Let's get all the doctors down here. It really was a way to inform the media, but then it really turned into education for the public and a place for truth. Talk to us about that and just sifting through and answering those questions that were coming in so fast and furious from the public.
Yeah, you know, and one thing that Hawkeye mentioned earlier, the number of hours we spent on a Sunday, and that went on for months as we tried. And we had started it in February. As I remember, I'd try to go someplace with my daughter in Utah. I was like, dear, I'm going to spend the entire time on the phone. And we did, because we were talking so much about it. And that was in February, and then we were ready for March. We had seen the things in Italy. We knew it was in the U.S. We knew it was coming. And then the questions were rolling in. And Hawkeye and I would be down here in this very studio, and there would be a phone. The phone was right here. And we would huddle around the phone together because, you know, God knows we didn't know about infection control back then, or at least we certainly didn't know about all the things about COVID, about SARS-CoV-2, yeah. And then all the reporters were all right there. We're all in this room, and the doors were closed, and you're like, you look back on that now, it just makes your heart hurt because we did it so wrong. But I think what we've learned over time is that the most important thing to do is you don't flapjack. You don't flap your arms and jack with the truth. You got to just tell people how it is in a calm, reasonable, thoughtful voice, making sure that you don't come across as some, you know, dire end of the world person, but rather, I think, trying to talk a little bit about hope, trying to talk a little bit about trying to work together to keep each other safe, and then relying on time and science to help develop more answers. And in doing that, we can keep a community safe. And that was really our goal. And the key to our voice was just to tell the truth and be calm and thoughtful and logical about it.
Well, you just said it, and you said our voice, and I think that's what people really remember. Both of you for sure, but Dr. Seitz, your voice, I think. I
sound like Mahomes. I know. I get this.
Exactly,
I'm also a froggy voice. I get it. Yeah, I get that.
I always relate it to when I don't like turbulence on an airplane, and so when I sit there, and I always look at the face of the flight attendants, and if I see panic in their face, that's when I know I need to panic. But when I see calm and I see them buzzing around and checking things and going down the aisle, and they seem like everything's going to be okay, and I think that's what you reminded me of, is that if you get on here and you're amped up, then maybe there's something to worry about. But it was that calming that I think people felt like.
We both tried to stay pretty calm. Because we knew what the rules of infection control worked. And we had community lockdowns and people going in things. When you saw the things coming out of Italy and the amount of death, and then you saw it hit England, and then you hit New York, and you're like, you know, we got to be ready for this. And so people say, was that the right thing to do? Given what we knew and what we had seen, absolutely that was the right thing to do.
A lot of those things were working.
Because when you did that, the numbers began to fall, and then you could bend the curve. And how many times in this community did we get like the chief medical officers together and talk to politicians and talk to community leaders and talk to everyone and say, school officials, and say, look, guys, we just got to bend the curve. It's not forever, but it is for some time. And the thing is, what happens when you overwhelm the health system with COVID is you just don't affect COVID patients. You affect every kind of patient because you can't get care. And so that's what we were grappling with. And I think that fortunately we live in a community where people responded to that. And so, no, we try to be calm, we try to be rational, we try to be thoughtful, and we try to be honest. But when things were beginning to ratchet up like it did in January and February of 2022, it was time to say, guys, we've got to run the alarm.
Yep.
Because this is a more dangerous point.
Just lastly, before we get to any of your questions, I wanted to talk to you, Dr. Hawkinson. We yesterday the health system relaxed its mask rules. Yeah. I know you had mentioned you and your colleagues will probably still be wearing masks. It was hard for me to even walk out in the hall yesterday without a mask. I'm not used to that yet. Just real quick, both of your comments, Dr. Hawk, I'll start with you, just about kind of a new day.
I mean, I think a lot of the caregivers and care teams, have not liked the mask for many reasons. Patient care, it is kind of a barrier to communication a little bit, especially with someone who's hard of hearing, but just because it's uncomfortable. But surprisingly, yesterday, walking around the halls and treating patients and seeing patients, there continued to be a large number of providers that were still wearing masks. So I think it probably will decrease as time goes on, but I think it is certainly good right now that people are still doing it, and we'll just kind of see how it goes. I know I'm still wearing it, seeing patients as well. So.
How many times did we say on this program that this is all balance between quality and quantity of life? Yeah. And so what I think, the same thing is true for staff. First of all, we're in a different place in the pandemic because we know that, we have more effective therapies with Paxlovid and remdesivir and just our whole approach. Secondly, vaccination has made a huge difference, and our staff are required to be vaccinated unless they have an exemption, and so 99% of our patients, our folks are vaccinated. Third, we know that masking does work. And so if you've made a personal decision that either A, you're not feeling well today, B, you know you have risk, C, your patients have risk. I went up and saw one of my transplant patients last night and I put my mask on because it's like, no, he's a transplant patient. I do not want to have any risk that I would possibly give him. And I think we're smart enough, we know the science well enough that we can apply masking so that we can keep our patients safe. If we find out that we are unexpectedly transmitting disease, then we'll put masks right back on. We're not going to make our patients unsafe, but I think we can keep our patients safe, and we can communicate better. I'm sure Bethan would agree with this. How much easier is it to talk to your patients when they can see your eyes and you can see their eyes?
Bethan, are you glad to have the masks off? Just out. I know you still wear it up on your unit, but thoughts on the mask being lifted?
I think I'll probably continue to wear a mask forever. We look back now and we're like, why were we not wearing masks when we were intubating people and really getting everything in their respiratory system in the room? But I do think it's nice to at least have the opportunity to be able to pull your mask down and communicate, especially with those hard of hearing patients. I mean, I feel so bad throughout the whole pandemic. They've just had a really hard time. But yeah, I think it'll be nice and they can also just see your full face, and I think that makes a big difference too.
It does. It does. Hawk?
I think to Bethan's point, when she said, why weren't we wearing masks when we were intubating patients? I think from an infection prevention standpoint, this masking these past 3 years has also helped greatly in reducing the risk to other patients, but also our employees for other diseases such as measles. We know there are measles and mumps outbreaks going on. Exposure to when we have active tuberculosis patients. So it has helped reduce their risk of exposure as well. So overall, from an infection prevention standpoint, it has been very good also.
Dr. Steins?
Well, Jess, I was here on Sunday having to talk to an end-of-life type of conversation with a family, and it's so nice to be able to see them face to face. But to Hawk's point, we know the rules of infection control. What do? They keep you safe wherever you go. And we know that masking and distancing and coughing to your arm, and if you're sick, you don't go out. Those things work, and they kept us safe through the pandemic. They help save lives, and they continue to help save lives. Life's a balance.
Balance.
We have to figure out where we are in that balance, but that's part of our roles as human beings. Ultimately, we do have to do a great job of taking care of each other. I think we said before, masks are just a way of saying I love you.
Oh, I like that. That is nice. I like that. Let's see if we have any reporters on the line. We've got a couple community questions and some comments coming in. And Georgianne, I know you have been watching this program from the beginning, and we appreciate you always coming on and being with us. And her first comment is about Well, the cutest one in the room. No, not you, Dr. Stites. Graham.
Yeah, I'm not.
Graham. Graham is adorable. She says Graham's adorable. What an uplifting story. So on both ends. So thank you for that. She says your communication has been education. It's been a lifeline, especially in the early days of the pandemic. So thank you to the doctors. And Lisa says it's great to have Dr. Stites and Dr. Hawkinson. I said we got the band back together again.
Yeah, that's right.
But no singing today.
Oh, wait.
No. So a question from Erica is, what are ICUs like now? What's it like up there, Bethan? And Richard, I know that you've stepped away from the healthcare field, so I'm going to direct that towards Bethan.
I think it's hard to, so now it's still, so we're still a respiratory.
Oh, can't hear
you.
Oh, go ahead. Oh, sorry. Go ahead.
We're still a pulmonary ICU, so we still see some COVID, a lot of flu, a lot of RSV, lung failure, those kind of things. I think the difference between COVID and now is now in the ICU, there's typically 1, 2, maybe 3 that are the sickest patients on the unit that you designate your, most cared to, a lot of your team to. During COVID, it was like all 14 patients were the sickest on the unit. And so I think that's the difference now, is there's just more of a variability of critical illness. Some people are less critical, some people are more, and there's less severely critical patients than there were during COVID.
And then a question from John is, what is it like intubating someone?
For me, well, so as a nurse, my role is to push sedation and a paralytic medication to keep them paralyzed throughout the process. Normally, when you know that you're intubating someone just for a short-term thing, you feel confident that you can fix whatever problem is happening to intubate them. It's just kind of like a daily process. It's something that we do fairly frequently. But it's something, if we know that we can fix it, then we feel okay intubating, and we are pretty confident to the patient. Like, okay, we're going to put you on this ventilator, but we're going to fix what's going on, and then you'll come right off. It was a lot different during COVID because you just didn't know. But it is, I think when you sit and think about, like, man, we're taking over this person's ability to breathe, I think it's kind of shocking.
And last question is from Mary. Just simply, Tony, how are you doing today? How are you feeling? Do you have any post-COVID symptoms? I know you've told me many times you're just so grateful to be here. But how are you feeling, truly?
I feel, I have to remember that healing is a process. And so in that time, definitely waking up from being in the ICU and being on the ventilator is different than the movies. You don't just wake up and you're ready to go. It's been a process. But as far as with that, I don't have many long effects. Still deal with body pain, nerve pain, those kinds of things. But, it's making me choose healthier habits, going to the gym, do different things to just make my body move. And so, again, yeah, I'm just so grateful to be alive. So, when I look at those numbers, and like you said, there were so many people that had that same story that I had, I'm just thankful. I'm thankful I can deal with anything because I'm thankful to be alive.
And I have to say, this was the first wedding. Richard and Bethan's wedding was the first wedding that you officiated after you got out of the hospital. And to think that it was just them and their parents and you and Candace. I think that just speaks volumes. How much did it mean to you to fulfill that promise? When you're in the hospital and woke up, like I said, I think I just had to have goals that I set for myself to achieve. And that was a big one. I was like, okay, I got to get out of here so I can do that. I got to get out of here so I can get back to everyday living. And so it meant so much to be able to do that and to bless them. I've done lots of weddings. Yeah, that was my first one post-COVID, and being able to just felt normal, I think is what I liked about it. I have those moments that just feel normal now, and I love that. I love those opportunities. So it meant so much that they'd allow me to be a part of their special day, and they remembered me, and so it was great. Yeah. That was one for the books. I want to get to final thoughts, but it would not be right for me not to ask a couple of COVID questions that are coming in for our viewers. So Dr. Hawkinson, Betty wants to know, I was vaccinated in October 2022. When's the next booster?
I mean, right now, we believe the recommendation is going to be for a yearly COVID-19 booster. It will continue to be bivalent at this point in time. They are looking at maybe updating the bivalent booster just as they update the influenza vaccine. But right now, if you received your original bivalent booster in the fall, there is no recommendation for any other up-to-date updates to that booster. But we do expect that in the fall there will be recommendations for that yearly updated booster.
And Dr. Seitz, Susan just recently had major lung cancer surgery, so I don't know if it's the same situation for her, but she just wants to know where do elderly over 70 stand with the booster now. Do we need to get another one if it's been 6 months, and then another one in the fall?
Yeah, well, definitely one a year, and I think the jury's out on some of these highly immunosuppressed patients, and we were talking about the transplant programs the other day, like, are we still going to stay with every 6 months? I think some people are still saying every 6 months in the highly immunocompromised or at-risk population, but there's not an official recommendation from CDC HOC.
Nope, and that's why it is so vitally important to get tested early if you start having symptoms, and of course, if you can, get on Paxlovid. Obviously, there's an alternative therapy as well, molnupiravir. Those are both pills that you can take as an outpatient, so it is vitally important to test early and get on treatment early.
All right, and Sharon, Lisa, Ruth Ellen, I will pass along your lovely comments to both of our doctors this morning. Thank you. Thank you for sharing those. Let's get to final thoughts. Bethan and Richard, I'll start with you.
I don't know. I think my final thought is just I'm very grateful that for the time that we spent in the COVID ICU, that there's like a little story that we can pass on to Graham of, you know, the bright spot of those few years. I don't know how we're gonna explain those few years, but I think it'll be nice just to have like a happy anecdote.
No, it is not lost on anyone. It really is a story to share. Richard, any final thoughts? Anything to add?
Yeah, I think kind of the same thing. I mean, it was, like you said, I'm not in that career anymore, but it was something that I think I'll cherish. Just all the memories I have with the whole team on the unit up there on 61. So being able to tell those stories kind of going forward is definitely something to remember for Graham and for us.
Mm-hmm. Well, thank you both for letting us share your story. And Beth and I have been speaking with you over the last 3 years. So we spoke when you were just a nurse, and then you told me about Richard, and you said, I've met this guy. And so I've been waiting to share the story. So thank you for that. We will let Graham get back to his morning nap. And Tony and Candace, I'll let you share your final thoughts.
You know, I just think it's just great. It's great to, you know, I have such gratitude in my heart to be here and to be able to share the story, to build the relationships that we built. And that light came out of such a dark time in my life and in my family's life. You know, getting to stay connected with Bethan and Richard, with other nurses and doctors. We're friends on Facebook, and so it's cool just seeing what's going on in their lives. And you know, my church is right down the street from KU, and so I get to drive by and you know, and be thankful and pray for the people that are there. And so it's just great, the relationships that were formed, those times that, like I said, when I think of dark times, I can look at pictures and some of those things, they just don't even seem real sometimes, but I know that they were very real. And so I get to just have gratitude in my heart and be thankful that I'm here today, and I get to share this story and get to be with my wife and my kids and all those things that I wanted to do and were my reason to get out and keep going. So.
Well, we feel your gratitude. We appreciate your prayers as well, Pastor. Thank you. Candace, final thoughts. Always good to visit with you, by the way. You truly are such a ray of sunshine, and the whole unit up there loves you.
The feeling is definitely mutual. I think I'm the same, just so grateful and thankful. And, you know, when we talk about those dark times and just even my husband going through that, me watching on an iPad for a lot of days. And I remember I just kept thinking, I just need to get with him. I need to be with him, hold his hand, see if he's okay. And I remember the moment when I got the call, like, you can come up, and I, you know, went up, and I remember I was so nervous for what I was going to find. And and he was just so taken care of. Like his appearance, he looked good. The nurses, the doctors, they just took care of every part of him, and I just walked in and just felt like so relieved, and so I just want to say thank you to Unit 61, to every doctor, nurse, every RT, just from housekeeping to his room. Everything was just so well taken care of, and I think I was sitting there day after day, and I would watch them sacrifice their family time, their just so many different sacrifices that the healthcare system made for us strangers. And so I just never get tired of saying thank you for just doing your best, for showing up, for loving, for being my friend, and saying the truth, and just being hope, and just doing everything you knew how to do, everything you didn't do, for trying, and we just absolutely are so grateful for you.
Yeah.
Well, right back at you, and thank you for being our bright spot. We needed these stories, and we love to hear them and share them. So thank you, all of you. We appreciate you, and stay in touch. And Tony, come by and see us anytime. You're just down the street.
Just down the street. I will.
Okay, sounds good. All right, guys.
Yeah.
Dr. Hawkinson, final thoughts today.
Yeah. I mean, it feels good not to be doing this show like we were for so long. And that just means that we are transitioning more to pre-pandemic sort of life. But there are still steps to take. And we have to remember that disease is still out there. It is still in the community. So please take your personal health into that consideration and understand your risks. Be up to date with your vaccinations, just as Dr. Stites said. Get tested early. Get on those oral antivirals to help reduce your risk of severe disease and death. Those things do work, and we would like to continue to move forward. We are. And remember, the most important things as well, those rules of public health interventions go with you wherever you are. Hand hygiene is vitally important, the alcohol hand wash or the soap and water. And of course, if you ever do feel uncomfortable in a situation, it's always okay to wear a mask.
Dr. Stites, final words of wisdom today.
Yeah, my final words. First of all, I could have done without having to go back to that memory of the iPads. So
Right.
those were really, really stark times, and probably in some way encapsulated the whole pandemic. This has been the best story from love, and then from the faith and hope of our healthcare workers, especially our respiratory therapists and our nursing staff, who really in many ways were at the very frontest of the front lines of the entire pandemic, and had some of the greatest exposure risks, both personally and professionally. I want to say thanks to all of our viewers who listened and who were a part of this program, to our metropolitan area who listened. And I keep coming back to the same point all the time. The intersection of faith, hope, and science is a powerful place. And when it's surrounded by love, wow, that is also a safe place to be. And as far as masking goes, I remember there was a song once I wanted to sing that I couldn't, so I can only say it as a rhyme.
What was the song again?
Sweet Mask of Mine, which could be put to the words of Sweet Caroline, but of course I can't.
Get us in trouble with Neil
But we
Diamond.
can't do that. I'm not going to get in trouble. But
yeah.
Sweet Mask of Mine, I have never felt so fine, so fine, so fine, so fine. They do keep us safe despite all the thing. Yeah. And when we do that, to make my final Star Trek reference, we can all live long and prosper. Oh, there it is.
Your final.
Well, for today,
it'll
just
never
for today.
be final. It'll never be final.
Well, what's
It'll live
going
on
next
forever.
Wednesday? Huh.
Dr. Hawkinson actually has one more thing to say.
To his words, nobody wants to make Neil Diamond upset. But I would also like to really throw.
We had a great thing. We had a great song about that.
Don't do it.
I would like to throw a shout out and so much appreciation, because we are able to be broadcast and come to you because of the people in the production room. Logan, Cliff, and Anthony all worked so hard those first few years, and we're up just as much as we were to get everything straight in that production room to get us to be able to beam out to you wherever you may be.
I love Beam Out.
Yeah.
Right here in the Dulce Simons Family Studio.
What?
Beam Out.
Oh, Beam
right
Out.
here in the
Wow.
Dulce Simons Junior Family Studio.
And Thank you, Maggie, who actually really runs the show back
and
there.
now Stuart, well done, and Jill,
Stuart,
wherever she may be.
They're all out. I know.
Yeah.
They've left us in control. Thanks to all of our guests today, and thanks to all of our viewers today and for the past 3 years. We appreciate you being with us every single day.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.